Good morning. I now convene this morning's hearing entitled Where Have All the Patients Gone? Examining the Psychiatric Bed Shortage. Dr. Edgerson.
My name is Dr. Lamar Dimitri Edgerson, and I wish to thank the chairman, ranking member, for the opportunity to testify today at this very important hearing on the psychiatric bed shortage. My doctorate is in psychology. I'm a clinical mental health counselor and licensed marriage and family therapist. The population we are focusing on today is the population that I primarily serve in my private practice. Over the past year, I have served as the Director of Large for the American Mental Health Counselors Association, also known as AMCA. I'm here representing AMCA's 7,100 members. I am also a board member and two-time past president of the New Mexico Mental Health Counselors Association. Clinical mental health counselors are primary mental health care providers who offer high-quality, comprehensive, integrative, cost-effective services across the lifespan of the individual. We are uniquely qualified licensed clinicians trained to provide mental health assessment, prevention, diagnosis, and treatment. I grew up as a child in the welfare system with inadequate health care insurance. Since the age of 18, I have provided health care for patients. My career began as an enlisted member of the United States Air Force, where I served for 20 years as a medic. As a clinical mental health counselor, I now see children, adults, and families in private practice in Albuquerque, New Mexico. My specialty is trauma. Evidence all around us demonstrates the nation's mental health care system is in crisis. It is generating increased demand for inpatient psychiatric beds while simultaneously decreasing its supply. Because patients have trouble accessing services in the community, they use the emergency department for basic and intermediate care. Our current mental health system still suffers from poor transition from inpatient institutions to community-based treatment. In a recent scholarly article, Ms. Nalini Pandey estimated that psychiatric boarding lost nearly $4 million a year in revenue from service that could have been provided in lieu of boarding at just one 450-bed teaching hospital here. Ms. Pandey also found that as patients waited, sometimes for hours, some for days, their psychiatric health deteriorated. And a patient who often came in with manageable psychiatric illness subsequently turned into patients with acute needs. But still, there's more than meets the eye. We at AMCA believe some policymakers are going down the wrong path in addressing the problem of hospital boarding. The barrier to treatment is accessing timely, effective, quality mental health service in the community. Surmounting these barriers requires continuous comprehensive health insurance coverage that enables access to essential inpatient and outpatient care, prescription drugs, early intervention, and prevention programs. All of those essential benefits are provided in health plans governed by the Affordable Care Act and new state Medicaid expansion programs, and some are available to Medicare beneficiaries as well. We can make smarter to have a better, healthier system that systematically reduces crisis situations from developing. In addition to the importance of state Medicaid expansion, Medicare mental health services, too, have never been fully modernized to include newer providers like clinical mental health counselors and marriage and family therapists, such as proposed by Representatives Chris Gibson and Mike Thompson in H.R. 3662. Comprehensive and stable health insurance coverage is the key to cost-effective, efficient, timely mental health services in the United States. The new state Medicaid expansion effort has the potential for millions of currently uninsured Americans with mental health diagnoses to obtain greatly expanded access to mental health and substance use treatment in an integrated community-based setting with a person-centered treatment focus, the exact objectives I believe all policymakers are trying to achieve today. Unfortunately, 25 states are refusing to participate in the new Medicaid expansion program, which will continue to leave millions of uninsured people with serious mental health conditions out in the coverage code. AMCA believes it is a huge and costly mistake that Congress under Medicare and state policymakers under Medicaid have decided to deny their most vulnerable citizens state health insurance coverage with comprehensive health care and mental health services. In summary, Medicare mental health provider coverage modernization and state Medicaid expansion will provide health insurance coverage to millions of people with serious mental health conditions who have had difficulty accessing needed and timely service. These changes are necessary to dramatically reduce the chances of future crisis situations and increase and increasing emergency department visits. Thank you again for the opportunity to present this testimony today before the committee.
Thank you, Doctor. Appreciate that.